Today I'm going to tell you about fluoride. Fluoride is a compound that is highly poisonous to the human body. It is a cumulative toxin, which means that trace levels of it can build up in living tissues and never leave them. The vast majority of Americans are also consuming fluoride on a daily basis, and most of them don't even know that it's harmful. Fluoride is in our drinking water, our toothpaste, our mouthwash. They put it in your mouth at the dentist. It's found in some vitamins, in tablets for children. It's put in milk, in schools in some parts of the world. And worst of all, it's been found in baby formulas. The lethal dose of fluoride in an adult weighing 150 pounds is 5 to 10 grams. Yet every year, if you drank the recommended amount of water, which is 2 liters, you would be consuming over 2.9 grams of fluoride, much of which will never, ever leave your system. The reason we are told we should be ingesting this poison is for dental reasons. However, no proof has ever been established that fluoride does prevent cavities. In fact, statistics show, in some cases, that it actually can have an opposite effect. Fluoride hardens the teeth unnaturally, and it will eventually give them a stained, patchy appearance over time. This is a condition that is irreversible and is known as dental fluorosis. Here you can see the extreme discoloration of the teeth, and here you can see some spots where the teeth are almost transparent, which is a characteristic of the disorder. Dental fluorosis is caused only by fluoride, and it is the first real sign of fluoride overdoses. It has become an epidemic among America's children. Fluoridation of our drinking water has also been scientifically proven to cause cancer, Alzheimer's, low IQ, ADHD, learning disabilities, cognitive deficits, premature aging, genetic damage, low fertility, thyroid disease, skeletal fluorosis, and osteoporosis, which are both crippling bone diseases, bone fractures, birth defects such as Down syndrome, and ultimately death. It does all of these things, yet Americans are adding more and more fluoride to the water every year. Look at this chart. Since 1951, the officials have been allowing this toxin in our water. Only 3.3% of people had it at this time. However, in the year 2009, 69.2% of people have fluoridated water, and the number increases each and every year. You can see on this map which areas in the U.S. have more fluoride than others. Georgia is the 9th highest state, with 93% of its water being fluoridated. When you pair this data with cavity statistics for each state, you will see that there is no correlation between fluoridation and tooth decay. Look at this chart. This is comparing fluoridated and non-fluoridated countries' levels of tooth decay. As you can see, many of these countries in Western Europe and Asia have banned fluoride. They have banned it for health reasons, and some of them have referred to it as waste byproduct. Anyway, as you can see, all of these countries have a lowering trend of tooth decay. This may be caused by technological advances or people taking care of themselves better. However, we can clearly see it is not caused by fluoride. Now that we know it is not in the water to prevent cavities, why is it there? The public isn't really sure why. States are wanting this and allowing this for their citizens. Some people have a good guess as to why though. This is a graph showing money being spent on cancer in the U.S. since 1963. The number has risen from about $2 billion a year to over $70 billion a year. Cancer and other diseases are big business for many corporations. Pharmaceutical companies actually make more profit each year than all of the Fortune 500 companies combined. If you get sick, they get richer. It is sad to think that we may be mere dollar signs to them, but again, it is just a theory. If you don't want to consume fluoride, there are many things you can do to prevent it. If you have fluoridated water, you can purchase a filter online that will remove it from your water. If you aren't sure if you have fluoridated water, you can visit www.cdc.gov and find out there. If buying a filter isn't an option, then you can drink bottled water. Just be sure to call the number on the back and make sure there isn't fluoride in it. Read labels on everything, call numbers on the back of products, and research to get your own answers. Thank you, and remember, say no to fluoride.